So let's get started. It's my pleasure to introduce Annette Power, who's going to talk to you about twin pandemics, why we must reimagine health comms. And so Annette is the managing partner of healthcare communications, Pages for Good. Annette Power has dedicated the last 2 decades to working with health institutions and charities, such as Humber River Hospital, South Lake Hospital Foundation, Health Quality Ontario, Canadian Cancer Society, and the Multiple Sclerosis Society of Canada, just to name a few. As a communications consultant and community health activist, however, she has spent 2020 almost exclusively helping frontline community health centers across Canada reach, as well as raise awareness about our most racialized, marginalized, and vulnerable populations during the COVID-19 pandemic, which I think is an amazing, just amazing. So Annette, I please, turn it over to you, and looking forward to your session.
Right. Well, hello, everyone. This is really an honor. I've had an opportunity to participate. I've kind of been jumping through the variety of breakout sessions, and I've had a chance to listen in on a number of really vital conversations and really important next steps around the work that we're doing in healthcare and particularly around communication. So I'm quite honored to be a part of this panel. So thank you very much for joining me for the next 20 minutes. And then I'm hoping to provide value and entertain all the questions that may come. So I'm going to share my screen as a first step. Let's do that. All right, so twin pandemics. I think just by the name of it, it indicates some of the challenges of 2020 and what we've seen. But I wanted to take you through a little bit of a journey and looking at what have we seen? What, in fact, has 2020 looked like? I think earlier in one of the breakout groups, we talked about March 13th and what that date meant to most places around the world. In particular, I'm here in Ontario. That was, the shutdown, the lockdown related to COVID. So let's talk about that. In fact, I wanted to actually, now that you're in my space, and you can probably see behind me, there are a number of books and things that I've read over time. But one book in particular I'm always really passionate about is this one here, which is April 4th, 1968. And it's written by Michael Eric Dyson. And I had the opportunity actually to have him personally sign it and meet him when he released this book about, I think it was in 2008. But all that to say that he talks a lot about, Martin Luther King and his perspective on racism and some of the issues that we were facing, or, I wasn't alive at that time, but what the country was facing across America, but also how that had rippling effect around the world. And just how much of what he challenged and faced in his short life, we still continue to experience in the US, across Canada, and of course around the world. So it's a topic or a conversation that has no shortage. So 20 minutes is probably not a lot for us to really get into depth about some of these things. But just to touch on, you will see throughout my presentation that I do touch on some of the quotes that I have embraced and heard from him and how they relate to the work that we do in healthcare. So as mentioned, this is just a little bit about my background and the work that I've done. I have been really just invested in the healthcare space. I feel like if you don't have your health, then what do you have? So there's so many things that we deal with. But in doing that, the last 2 years, so just before my day job, the last day job I had was at Humber River Hospital. And I left that opportunity back in 2018 to go out on my own because I was really passionate about the work that I felt that was missing around communication and outreach to those vulnerable populations. I did not know that COVID was coming, but I did know that there was a gap there, and it was one that I felt I could help fill. And if you don't know much about Humber River Hospital, they're actually situated in the northwest part of Toronto and primarily service a community called Jane and Finch. So one of the areas that often is stigmatized just by the makeup of the community, and often an area that, interesting enough, as much as Humber offers the state-of-the-art healthcare, few in that community actually go there for many different reasons. So there's areas, there's issues around trust. So all of this spoke to why I felt this was a really important issue. And then, of course, with the pandemic, it really just served to elevate, where the gaps were and the need. Oops. So Martin Luther King once said that of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. If we don't have our ability to exist, to live, if segments of our community are not treated equally as human beings, then how do we have a humane society? So what happened when twin pandemics collide? Well, let's take, as I said, let's take a journey. Here we are, March 2020, and this is when the pandemic was officially declared. By April, in fact, towards the end of March, we also started to begin to see the anti-Asian sentiment and racism grow worldwide. Grocery stores or other businesses within the Chinese community around the world started to feel the economic impact of that, as well as we know that there were instances of overt racism and violence at times. By May, the tragic story of George Floyd, basically dominated headlines around the world, and also bringing greater emphasis to an existing pandemic. One might think about the COVID as a pandemic, but many who are from the Black or the Indigenous community would recognize that racism as a pandemic that has existed for many centuries, and this incident, tragic, horrifying incident, just created a spotlight on that. And of course, we saw protests around the world, masks worn, but still people were out in the street outraged by these issues. By June, if you're here in Toronto, anti-Black racism was declared as a public health crisis. And for the first time, race-based data was being collected, which would allow them to kind of actually see where were some of the communities, what were some of the instances and related to race that may impact, not even necessarily one getting it, but just how those communities might be, the differential incidences and the differential stats that relate to racial backgrounds and COVID. There was a lot of media and attention raised about that across the US. So we definitely saw, disproportionately Latin communities, as well as the Black community with higher rates of COVID, as well as dying from COVID. Here in Canada, we saw Indigenous communities and the risk to Indigenous communities, just by the locality of where they live, and this cultural customs also created greater exposure. We also learned that in other other groups, other ethnic groups that we would see, racialized groups that we would see based on the type of work that they did, that there was greater exposure. So what does that mean around communications? How are we best able to reach groups without stigmatizing those groups? So these are just some of the questions that started to emerge in some of the work that we're already doing. Throughout the summer, stats, those early stats that came in from this new collected data revealed that 83% of those cases in Toronto were impacting racialized communities. That was huge. And that also spoke to the types of jobs, the types of work that put those communities often at greatest risk. The frontline positions, we often celebrate those that are within the confines of a healthcare setting, but we also want to talk about those who are doing the frontline, the essential worker positions that allow these communities to allow all of us to keep moving, whether it be Uber, the gig industry, or public transit, or, we know a number of PSWs were also, when things were emerging, were also greatly impacted, disproportionately impacted by the work with the lack of PPE, really resulted in some horrifying, work-related deaths initially. So come September, teachers, parents, healthcare sector anxiously preparing for that back to school, during COVID-19, and then also what does that mean during the second wave? And that was true of all communities. I think that it was, particularly of concern in some of the things that I heard in the work that I'm doing with community health centers, that, some communities were also, because of being stigmatized by COVID, concerned about kids taking that to the playground. How would that impact children on the playground who may be of Asian descent? And, kids not understanding the ramifications of that. Also, just the heightened sensitivity around racism during that time. How are all these things being addressed in, whether it be in the school settings, but also this plays out in healthcare. And a good example of that we saw with the case with Joyce Echaquan, 37-year-old mom of 7 children, and she dies in a Quebec hospital, I think in Joliette, while the video, she was streaming her video live, speaking her Indigenous language, trying to plead to her family for being over medicated and the care that she wasn't receiving. In the meantime, you could hear nurses who were in her care, or she was in their care, mocking her, saying really shameful comments, and she later died that night. So there's a huge inquiry obviously continuing to happen in Quebec, and for those who follow the story, there's been a lot of controversy around how that's being handled, and what are some of those issues. So that's really important step that as healthcare workers, imagine if you were in that space, and we'll do a little exercise in a minute, but just imagining if you were the comms department at that hospital, how would you be managing this crisis? In November, a report was released that talked about, in fact, early in June of 2020, there was a claim made in BC that the nurses had a sort of Price is Right, sort of spin the wheel sort of game going on, that they would try to guess the alcohol level of folks who came in to emerge, obviously with high levels of alcohol, poisoning, etc. And that was exposed in June, and an inquiry was made. And then as of November, at the end of November, almost at the very end of November, the report comes back and talked about not only about that incident, but also talked about the widespread anti-Indigenous racism that was being felt across the entire healthcare system in BC. And they're now going through, repair, trust building, beyond that policy. I mean, in every scheme, they're now peeling back the layers and looking at how that has impacted the Indigenous communities, and often for many that also relates to not going to the hospital because of the fear. So how does that impact one's health because they don't feel welcome, or they don't feel that this is a place, with these kind of headlines, that they're actually safe. Then come December, we continue to see that, well, we are in December, so we're just at the beginning here, but we're in this second wave, and stats continue to reveal that there's been little change in the impact in terms of the communication reaching those communities and effectively changing the outcome of the COVID's spread around some racialized neighborhoods. And that's, there are many different factors that contribute to that. Often in some racialized communities and neighborhoods, you've got high-rise buildings, people are sharing the elevator, there's all those types of things that you live in close proximity. All those things contribute to the higher sense of exposure to COVID. So I'm going to try to set up a video here, and I'm going to, let's see if I can do that.
After a racist incident that led to the death of an Indigenous woman in the Joliet Hospital. Joyce Echequan pleaded with staff to help her, but instead she was insulted in her last moments, and the incident was caught on video. A warning to our viewers, the details are disturbing. Gloria Enriquez is following this story for us, and Gloria, people are outraged and they are disturbed, and some have gathered near the hospital tonight.
Yes, Tracy, family members and people who knew 37-year-old Joyce Echequan are gathered here in Joliet. They brought posters demanding justice for the mother of 7. They will be making their way down to Joliet Hospital, just a few blocks away from here, in order to hold a vigil tonight. Now, according to community spokespeople, Echequan went to Joliet Hospital complaining of stomach pain. Once she was in the hospital, she was pleading with hospital staff to get help, and at that point she started live streaming on social media. In the video, you can hear her screaming in pain, and you can also hear nurses insulting her.
Est-ce qu'ils penseraient tes enfants de te voir comme ça? Pense à eux autres un peu. C'est pour ça que tu veux. Le meilleur pour fourrer que d'autres choses.
Community leaders are denouncing what happened to Echequan and say the government is not doing enough to apply the recommendations in the Viens report, a government report that looked into how First Nations are treated by Quebec's public service.
So as we think about this, certain conditions, Martin Luther King also said that certain conditions continue to exist in our society, which must be condemned as vigorously as we condemn riots. But in the final analysis, a riot is the language of the unheard. So speaking to Jen's point, these protests are now emerging in Alberta that happened in Toronto. This is just kind of this built up frustration where people themselves just don't know how to articulate it any more than, acting out, and particularly as young people who haven't been on this earth as long, but these things are very real to them and don't have, the years of context or may not, and I shouldn't make that assumption. I shouldn't, but I do know that, this level of protest probably didn't happen in many people's lifetime until now. So it's really enlightening. And it's for me, in my age bracket, it's really exciting to see this level of voice, and the desire to be heard, and that sharing, that collective voice, across many racial lines. Whoops. So, but why is all this happening, and how did we get here? And I mean, this in itself could be my own dissertation, PhD conversation. So I'm going to try to do it in 10 seconds. But really, when you think about it, at times, think about this as a gardener, right? So where does institutional racism come from? And it talks about, the power that be, but also the soil and the fertility in the environment in the society that has allowed, certain groups to flourish and others not. So if you think about a gardener who has two garden boxes, and in one they have, some seeds that they put into some really fertile soil, rich, lots of nutrients, nitrates, everything. And then you have another box with soil that's got, it's rocky, it's dusty, just not quite the right mix. And there's a lot of things that continue to that have been there for a long time. But you decide in good faith you're going to put these seeds in there and you want them to grow. You come back in 3 weeks and you think that both of them has ultimately been exposed to the same environment. So why are they not both flourishing? And then you see that, to some degree, those the environment in which the pink seeds are existing versus that of the yellow definitely make a definite difference in their ability to grow and withstand the elements and things that could continue to keep coming at them. But you take that another step further, and you think about that gardener is actually also of the yellow seeds. So there's a natural affinity. There's a natural affinity to have, continue to nurture those yellow seeds. And there's a connection. And there's an allyship, existing allyship to that particular group of seeds. And may not be so concerned about equity, because as far as I've treated them both the same, not aware of the history and all the elements that make up that soil that have made it difficult for this particular group of flowers to actually grow and flourish. So that, hopefully in 10, 20 seconds, it just kind of gives us an idea of where some of the imbalance has taken place. And that imbalance, as a result in the healthcare space, really reflects, that added level of stress. Racism itself can be a pandemic because it's layered with, tremendous degree of what I've heard in my community. You may not have heard this term, perhaps you have, but it's not post-traumatic syndrome, it's perpetual traumatic syndrome, right? This isn't an existing, and from the moment that I was born, my parents didn't know what my gender would be. They didn't know, what disabilities or abilities I would have, but they did know what my race would be based on who they were and what inherent stress or inherent issues or concerns that would come with, right? And how do we now continue to take the rocks out? How do we now, take some of the soil that has flourished for the yellow flowers and put some of that, integrate some of that soil into that pink box? So those are some of the issues that really will help us to begin an equitable dialogue. And I'll talk a little bit about equity a little bit more, should we have the time. So how do we reimagine health communications? So here are my 10 commitments for real change. I'm gonna try to zip through these, but and we'll leave room for conversation. Number one, let's acknowledge racism is real. Let's name it and let's put it on the agenda. Let's not be afraid of having that dialogue and having that conversation, whether it makes one uncomfortable. Let's get past that uncomfortable part, because there's people who've been living uncomfortable for a long time. That it's not an option. So let's just put it on the table, and we've seen that more and more, particularly in the healthcare space, and we want to see that continuing to engage, and that has to be on the agenda at every level. To speak to Bill's point, let's educate ourselves. Often I have friends and people, and I love opportunities like this, and I applaud those who have proactively sought out this conversation. And that is a part of that step, right? Just understanding the conversation before the potential, the risk of pontificating on what the issues are. Let's learn. Let's have a dialogue. And do your own research. I mean, we live in a time where there's a lot going on around Google. There's a lot of valuable information that we can take on our own proactively and learn more about. Let's recruit. Think about your department. Think about who you have sitting at the table, and are they reflective of the community that you serve? Are they reflective of those that you're trying to communicate and reach? And if they're not, find ways to do that, and including them at that leadership level as well. And also find ways that if you're looking for alternative and you don't have the resources to bring on new staff, look at creating groups that will allow creating diverse groups that you can consult, advisory groups, that their ideas are compensated as well to differing degrees, and also that they have their voice can also go to all the levels of the organization. How do you invite those voices if they're not currently there? Recognize diverse talent beyond diversity campaigns. So, there's often this kind of thing that I've lived with, and many of you, here comes February, it's Black History Month, or, in June, Indigenous, month. And then all of a sudden you're engaging people of that community to kind of say, hey, what should we do? And again, there's so many other racialized groups that celebrate months by month, but that's a story that needs to be told throughout the year. We don't want to wait for May for Asian Awareness Month, etc. Right? We want to make sure that these compelling stories, we recognize diverse talent on our teams, throughout the year, and their expertise on a myriad of topics, not just those that are diverse related, but they all of us, we all bring unique skill sets and understanding on a variety of topics. I just find it very interesting. I often see, as a result of what unfolded this summer, all of a sudden we see a lot of statements and individuals being profiled, but those individuals were there before. These issues were still there before, right? So not waiting for that moment to find a reason to celebrate those points. Build connections with culturally diverse media outlets and communicate in other languages. That's critical. That's really critical, right? If you're speaking to populations, and as you were saying, Toronto's very diverse, Windsor, extremely diverse, Montreal, Nova Scotia. These are places that I've had an opportunity to visit, BC, and all these are really diverse cities, and they have really trusted media outlets in those communities. People want to hear from them. Hold media outlets accountable for racial bias in their storytelling. If you're seeing headlines that really wasn't the story that you pitched, but they somehow have changed that, or if you see other headlines, send a message. Send a message to that outlet. They want to continue doing work with you. They need to be on. Somebody needs to let them know. Seek and support vendors from diverse communities. There's a tremendous amount of talent. Not always go to the vendors that you're comfortable or familiar with. Push the envelope. And then commit to represent and tell stories in a humane and empowering way. Often we see stories where we exploit someone's pain and their injuries, and we put a face, racialized face in the cover of that, to which we wouldn't do for other cultures. And so we just got to be mindful, particularly when we're describing or presenting racialized people that have already been traumatized, have already been depicted in inhumane ways, that further exacerbates that stereotype, that perception of them being victims as opposed to victors, right? So you have your victim, but you have a victor who overcomes some of these pieces. So I'm not too sure how familiar you are with the John River story, but his family, his mother made him, before he went to the hospital, although in excruciating pain, would dress him up, because she knew that if he went there in his casual wear, that he wouldn't have been treated, right? That he had to present himself in a particular way to be given the care that he deserved at a hospital. Number 9, lasting communication policies. As I mentioned earlier, the statements came out. There's swag out there. There's protests and fist up. But let's go deeper than that, and let's put communication policies, including your branding standards, your guidelines, that talk about how you will depict people of varying backgrounds, and also how those policies need to be a part of that conversation. How do you communicate about different groups? How do we proactively speak or identify racialized groups in the work that we do and the people that we serve? And last, let's listen to understand. Often we listen with an idea of, like, I've got a question, I've got something to say, we're listening to respond. But how do we listen to truly, respect or take the opportunity to learn from those who are often not heard, and their voices are not as widely heard? And you would think this is an example here where Serena Williams, and it almost died, having her child, because the hospital care didn't think, her doctor didn't think that she was actually feeling pain, didn't believe her. So it was very insensitive, and she writes about that. But just an example that we really do need to work to listen to understand. And last but not least, people fail to get along because they may fear each other. They fear each other because they don't know each other. They don't know each other because they have not communicated with each other. How do we begin to heal and bridge the gap, regarding communication